Thank you so much for stopping by our poster. We're going to briefly discuss the ways we are collaborating to improve autism spectrum disorder training opportunities for first responders. My name is Sam Mishra. I am the EMS for Children Coordinator in the state of Michigan. And with me today, I have Brandon.
Hi, I'm Brandon Hausbeck. I've been a firefighter EMT for 13 years, and I'm also co-founder of Carter Kits. Carter Kits was founded in 2019, and it's named after Carter Sievers, who is the son of one of my fellow co-founders, Justin Sievers. Justin is a police officer. Carter has ASD, or Autism Spectrum Disorder, and we wanted to develop a way for those who have ASD or hyper or hyposensitivities, sensory sensitivities, to a better way for them to communicate with first responders at emergency scenes. The mission of Carter Kits is to make the world a better place by developing and promoting an affordable means to address common comfort and security needs of children in crisis. If you look at the first column on the poster, you'll see the kit items that we have contained within the Carter Kit, and each item is clinically proven and vetted by our co-founder, Dr. Ellen Preen. Dr. Preen is a clinical neuropsychologist, and she specializes in ASD research. So you may ask, why is this important? Well, we know that 20% of those with ASD will interact with police at some point during their lifetime. To me, that's a very large number. Further, we also know, thanks to an SVSU study that was done, which is Saginaw Valley State University, 57% of first responders have 1 hour or less of ASD training in the last 5 years. So ultimately, we developed Carter Kits to help foster better rapport, communication, respect, and better outcomes.
When I met Brandon and the rest of the Carter Kits team, I knew right away that we had an excellent opportunity to collaborate and work together with our resources and missions that both really paralleled one another. It was clear that their effort with Carter Kits reached much farther than just creating a bag of tricks, honestly. It was much more than just the contents inside, although they are all wonderful. It really proved to me that they took this very seriously because they sought the expertise of a clinical neuropsychologist to learn about the neuroscience of autism spectrum disorders. It so happened that at the time that Brandon reached out to learn more about EMS for Children program, I was actually working on creating a program for our first responders here in Michigan that would address autism spectrum disorders, hypo and hypersensitivities, as well as to start to curate a kit for our own agencies. So the timing seemed pretty wonderful, and we really hit the ground running. In the second column on our poster, you can see a bit of an abridged timeline which shares some of the highlights of our journey so far. We immediately jumped into creating and producing a free education opportunity, which we knew we wanted to record and house online so our providers could access it on demand anytime that they had the opportunity to receive the training. This training opportunity was done live initially and recorded. We had such overwhelmingly positive feedback from our participants that we knew we were on the right track, and we continued to dig in deeper and find new partners to support this endeavor to create and curate excellent, high-quality, evidence-based training opportunities for first responders. When we met with the EMS On Air podcast crew, we were asked to speak, and we have done one episode with several more under production to bring the opportunity to first responders where they are. The wonderful part about the EMS On Air podcast is that it's in a really new and fun format, so providers have really appreciated that the education comes to them where they are and when they're ready and able to access it. It's a little bit more of a casual setting and really easy to listen to on any of the platforms that you prefer. In addition, American CME has been gracious enough to host our education opportunities and has sought CAPC accreditation for any of the courses that we wish to produce from Carter Kits that addresses autism spectrum disorder, because they saw the great value in bringing this very needed and sought after education to the providers where they were. And any provider that's interested in receiving that training can access it on those two sites that we mentioned. In addition, Brandon and I are very easily reached anytime by email. We have those listed in the bottom corner of our poster, as well as a QR code which you can scan and check out the Carter Kits website, which also hosts the information and education opportunities that are currently available as well as are to come. And we look forward to talking with you at the All-Grantee meeting. Thank you for stopping by our poster.